Welcome back. Broadband internet service has become a must-have during the pandemic. Think about it, from ordering food to helping students get through school. But there are households in Chicago still operating without it or with very poor service. Many of those homes are in Black and Latino neighborhoods, already facing an achievement gap. It's likely the pandemic will make that divide even wider. Kids in those neighborhoods just don't have the tools to keep up. A recent study puts the number of students affected in Chicago in some way at 110,000. With empty classrooms all across the country,
Louisiana and Texas seceded from the Union.
Remote learning has taken a front seat.
We will not allow this crisis to be an obstacle to our students' future and their dreams.
A priority that requires some work. By now, many students have laptops and Chromebooks, but keeping them connected is a constant challenge.
When you want to load things documents or read something, it just takes a long time to load.
The Arriaga family is experiencing it firsthand. 3 boys, all teens, and mom trying to navigate at times a tech barrier and a language barrier too.
El internet, pues ahorita está fallando.
She says the internet is failing right now. We have basic internet through school for $9.99.
Hay días que los niños no se pueden conectar.
There have been days this week when the kids haven't been able to connect. I've been on the phone with the company 4 times. In fact, I did my interview with the Arriagas using a phone.
No vamos a hacer nada más.
Even that had its challenges. Wait 1 second.
Sí, pero le digo, está.
And we're back.
Está muy mal esta conexión.
Their story is not unique. A new Kids First Chicago report titled Digital Equity in Education in the Coronavirus Era points to a bigger problem. It estimates that 110,000 students under 18 are without broadband internet in the city.
That's a pretty big number of kids that are basically working out of packets, and you're hoping that they're doing the work and, they're doing what they can to connect to the schools when it comes to their educations.
Daniel Anello runs the organization that put together the report. It goes on to say that even more affluent white communities show rates of 90% connectivity, still a 10% hole.
And one of the frustrations was this reality of, do I pay for food or do I have to continue to think about internet access? Because internet access is actually my lifeline to a future job in this current state.
It doesn't end there. Even college students had a similar issue. Anaya Davis paid for schooling and living on her own and just graduated. There was no room for broadband internet in her budget.
Not everyone can afford Wi-Fi. A lot of us had to go to coffee shops or just go to different places and libraries to be able to, do homework. And I felt like that was really overlooked. And it was kind of, for me, it's embarrassing to kind of have to tell my teachers and my faculty that I may not be able to be a part of class because of financial issues due to technology.
Here's how the numbers shake out in parts of Chicago. The top 5 most affected areas are at number 1, the Austin neighborhood, followed by South Lawndale, Belmont-Cragen, Humboldt Park, and South Shore. These are areas that have also been hit hard by the virus, which means students in those communities will be at a huge disadvantage even when they eventually go back to class. Parents know the issue well.
Otherwise, authorities and businesses like internet providers, I don't think that there is an urgency in them to make sure that the families have access to internet.
You can use hotspots, you can use some other, you can use your phone potentially to bring in wireless, but the speed at which you're trying to operate is not going to be sufficient if you want to do really robust remote learning or any kind of video conferencing.
We reached out to the top 2 city providers, Comcast and AT&T, to see about options for free service. There are plans that can help, but they have restrictions or only offer free service for a few months during the pandemic. There's nothing to address what will happen once the stay-at-home order is lifted, as some sort of remote learning is likely to be the new wave.
Internet is not a luxury anymore. It's a need.
Many agree, and it could have a long-term impact, dividing the skills and knowledge of kids with internet and those without.
What this COVID-19 pandemic has taught us is that we need to be prepared to teach and to learn across different modalities. So one thing that we haven't spoken about is teachers and their ability and capacity and their own professional development in order to deliver their courses in a completely virtual environment. I think that many educators were caught somewhat off guard when they had to make this shift very quickly.
It's been a challenge for everyone. The Arriagas are doing what they can to be ready for what lies ahead, one connection at a time.
Joining us now to continue the conversation are Father Michael Pfleger, who leads the faith community of St. Sabina Church in Chicago's Auburn Gresham neighborhood, and Dr. Carol Adams, president of Urban Prescriptives. Thank you both so much for joining us. I don't have to tell either one of you that these are inequities that have faced black and brown people for decades, for hundreds of years, I should say. And Father Pfleger, for instance, when you and I talk, you always talk about being hopeful, regardless of what happens with violence or anything. But how hopeful can you be in that bringing this to light nationally could bring about a change?
Hoping that this pandemic has once again just put a spotlight on the realities that we're facing. What have all the scientists told us? That those with pre-existing conditions are most at risk with this virus. Well, the West and the South Side have pre-existing conditions of unemployment and this digital divide you just spoke about, the poverty, the lack of academic access, lack of healthcare access, lack of healthy food, a lack of affordable housing. So all these pre-existing conditions have created the reality that makes the West and the South Sides most vulnerable. The West and the South Sides have been quarantined, have been social distanced for decades, as your report is showing. The question is going to be now to find hope in, and not just hope, but also the fight. What are we going to do how are we going to make sure coming out of this that we don't go back to normal? Normal was bad. How are we going to go forward and create a new equality and equity and equal playing field in the city of Chicago?
That's true. Normal is not necessarily the way the black and brown communities want to go back to. Dr. Adams, do you think as the country starts to reopen, the city starts to reopen, they should use the black and brown communities as a compass as to how to do that?
Well, I think that what we have to do is address two things on a parallel track. This immediate crisis and then some long-term strategies that will move to correct the conditions in which we find ourselves, all of which really stem from structural and systemic racism, long-term inequities that have impacted our community. As Father Mike said, that pre-existing conditions. We already had a pandemic. It's called poverty. Right. It's called unequal opportunity. It's called discrimination in the medical field, experimentation. It's called being turned away from the hospital 3 times when you're trying to tell them that you have the symptoms that are related to COVID. These things are still going on. So it's not they're over. It's environmental racism, pollution, food deserts, a whole litany of social ills that have contributed to putting us in the place where we are right now.
So who needs to step up? Who needs to say something? Black leaders, Hispanic leaders, federal government?
All of the above. Our churches, our legislators, okay? We still see things happen in our public policy that disadvantage the black and brown. Still, it's not like these are things that happened a long time ago. They happened yesterday. They happened today. They happened today in a hospital somewhere where somebody thought that a black person could tolerate more pain, and so they wouldn't give him any pain meds. Or it happens when you close down a shredding plant in Lincoln Park because it creates toxins and pollution, and then you relocate it on the southeast side. You already know what's wrong, but it's okay to put it in the black and brown community. It's not okay to have it in Lincoln Park.
Not to mention the lack of health insurance. What's going on with America's health insurance, Father Pfleger? Why is that not helping?
I think first of all, when you're first going to the testing site, first was the reality that in the Auburn Gresham had the first death of the virus in the city of Chicago. And we fought for now 2.5 months. Just this past weekend, did a testing site open up in Auburn Gresham? Why do we have to fight for 2.5 months when we're saying that the greatest deaths are happening in the black and brown communities? And then remember the early testing sites, they were told, You had to have a letter from a recommendation to go get it from a doctor. Well, many folks in the poor communities don't have a doctor to recommend them to go. Or did you have insurance? You would have insurance, some were turned away. So, you know, we have to make sure that right now, as Dr. Adams just said, everybody, the government, the corporate, the preachers, the churches, and from the community, we have got to demand that everybody gets health care, to demand the equal education. The digital divide should be raised. Right now, internet should be provided throughout the entire state of Illinois. Right now, that should be done. That should be an issue with our legislators.
Do you think, I'm sorry, Dr. Adams, go ahead.
I am looking at the kind of money we are spending right now on internet and on cable, because when we are confined to our home, we're watching all kinds of programs. We're adding other things. We're paying cable bills, some people as much as $400 a month. Those companies need to step up and provide broadband in these poor neighborhoods so our children who are struggling with their schoolwork can have access. We need to make more demands there. They're not suffering. They're not losing money. They're making money.
Dr. Adams, thank you from Prescriptives, and thank you, Father Michael Pfleger. We could talk to both of you all day, but I hope you will continue to watch the rest of this program, and hopefully by the end of it, we can come up with more solutions. We appreciate your time. Be safe, be well.
Michael.
Like the rest of the country, Chicago small businesses are struggling to survive. Up next.